The Central Florida Behavioral Health Network manages a quality behavioral health system of care that brings hope, help, and recovery to individuals, families, and even communities. Their president and CEO is back with us to introduce another organization that helps them with their mission. Alan Davidson, of course, is down there alongside today Kevin Marone, president and CEO of the Boley Centers. Gentlemen, welcome. Always good to have you, Alan.
Thank you for having us.
Nice to meet you. I mean, really is a team effort, Alan, when we talk with you, being able to put individuals first in a large area of our home here.
No, absolutely. And so what we do at Central Florida Behavioral Health Network is we are the funder for a lot of services and services for people that don't have insurance. And there's a lot of people in Florida that don't have insurance. And so we fund services from Pasco County down to Collier County, over into Hendry and Glades, and up into Polk, Highlands, and Hardee. About 65 providers and a variety of services like crisis care, case management, care coordination, and with Boley Centers and Kevin, housing.
And I'm so glad, to learn more and what you're able to do, of course, making sure people get the help regardless of insurance, of course. First off, I think a congratulations is due for Kevin. 55 years, your anniversary at the Boley Centers. I want to recognize that, but how did you get started? Because you have a different approach to help individuals.
Yeah, absolutely. Boley Centers opened its doors in May of 1970, and at that time it was just a single residential home known as Boley Manor. But it was the grassroots efforts of three visionary women, Mrs. Bessie Boley, Mary Koenig, and Ruth Mosier, in the late 1960s that laid the foundation for what this organization would become. Now, at that time, individuals with mental health conditions were being housed primarily in mental institutions with little opportunity or dignity. Their vision was simple. It was with the right housing and supports, people not only could recover but live meaningful lives in the community. Since then, Boley has grown and developed into a comprehensive supported housing and rehabilitation program with over 1,000 units serving the needs of people in the community with mental health, chronic health conditions, opioid and other substance uses.
Man, just to hear that growth in numbers is incredible.
Absolutely, yeah.
And, I want to talk about being able to help the whole person. I feel like that's one thing that really stands out, addressing the whole person's needs, not just that one factor that may have brought someone to the Boley Center, right?
That's right, because, the people that we serve have, not just the mental health issues, but sometimes substance use, chronic health, trauma, histories of homelessness, and those types of individuals interact with one another. You can't just, recovery doesn't happen in silos. It happens when people get the right treatment, feel safe, get the supports that they need, and most importantly, feel connected to their community.
I want to dive in a little bit more on the support system because, of course, you were talking, Alan, you help those in the community who may not have insurance, making sure they have the means to do so. How important is that structured treatment that Boley Center is able to offer and being able to approach all aspects of an individual? How important is that in one's success and even one's maybe remission, if you will, or being able to, focus and live a healthy, happy life, like you said earlier?
Yeah, that's a great question. Residential treatment is a critical part of the recovery process, especially for individuals with long-term instabilities, people with substance use conditions. It is that structure, that accountability that helps them to, prepare for the next level of independence. Without that structure, individuals tend to cycle through hospitals, jails, shelters, and the streets. But with it, they can stabilize, they can, get the treatment and engage in treatment, and I think more importantly, they can vision a future for themselves again. At Boley, because we provide both the housing and the services, we're able to walk alongside those individuals throughout that transition. So that's not just discharged and then forgotten about.
Right.
They stay connected to case management, stay connected to the services, and really that's what helps kind of reduce relapse, reduce recidivism, and most importantly, improve quality of life.
Oh, I'm so glad we were able to learn about the Boley Centers today. And Alan, I always like looking at you. I can just tell you're so proud of the work that you're able to do to facilitate people being able to have the help that they need. We want to make sure and share the information, of course. In fact, if you want to learn more, hopeforsuncoast.org is where you can learn more for CFBHN information and also the Boley Centers, which their website is there as well.